Hi everyone, my name is Dr. Christine Schaffner, and today I'm going to give you a little talk on something we call tonsils, teeth, and TVAM, identifying interference fields and recovering brain health. Before I get started, I just wanted to thank everybody. Dr. Klinghardt and I and everyone at Sophia are new to emailing you all, and we really appreciate all the wonderful feedback and requests for content that you want to see from us. And we're busy putting all of your answers together, and we're going to be rolling out that content in the next few months. So we really appreciate the time you all took. And one of the big goals for us and why we are really passionate about sharing information through this resource is that we see so many people who come to us at Sophia who have seen a lot of doctors and have been sick for a long time, and we want to make sure that we're sharing the information that we know to more people so we can shorten the time between when people get diagnosed and on the right treatment, so people don't have to suffer as much. So that's our goal. And many of you also know that we see a lot of neurological disease. We see also a lot of chronic illness. And my goal for sharing this information today is to just identify a few key things that we see are often overlooked when people come to see us. So we'll just dive in and get started. And I hope you enjoy the information. So again, who we treat. So Dr. Klinghardt and I started Sophia Health Institute in 2012. I have been working with Dr. Klinghardt since about 2010, and he's been practicing for 42, 43 years. So he has a ton of experience, and I feel really blessed to learn from him. And we have a team of wonderful doctors at Sophia, and we see a lot of people who've seen a lot of doctors. And so we have a very outside of the box approach in how we evaluate our patients. And so just to give you an idea of who we treat, often our patients are sick for decades. They've seen over 20 physicians. They have a number of symptoms that are multisystemic. So brain fog, fatigue, insomnia, pain, gut dysbiosis, depression, anxiety, neuropathy, endocrine imbalances, and much more. And so one of the concepts that Dr. Klinghardt has taught us all at Sophia is something called an interference field. An interference field is actually a term used in neurotherapy, and it's a really good, I think, way of identifying what has been overmissed or what are the roadblocks to someone's healing. And so really the definition of an interference field is a local tissue irritation with potential to cause what we call destabilization of the autonomic nervous system, either locally or systemically. Area that has become depolarized after trauma and more prone to toxin accumulation. So this is getting more in depth of actually what it is. And I know I'm talking right now to not only potential patients in the public and also practitioners. So I'm trying to talk to all of you with all of this. And so one of the things to think about is an interference field. It's an area that has been chronically stressed and might have a chronic infection that is, essentially creating symptoms in the body. So examples can be scars. We do a lot of scar therapy at Sophia. The teeth. I'm going to talk to you a lot about the teeth today. The tonsils, they can be chronically infected. I'm going to talk to you about that. Also different organs that have been chronically stressed, areas of injury if people have had a traumatic brain injury or a severe car accident, and then different ganglia can be what we call blocked or stressed. And ganglia refers to a group of nervous system tissue that helps to communicate, to the periphery and to the brain. So this is just a definition of what we call an interference field. And then again, my talk is what are the common interference fields that we see at Sophia that are often underaddressed for years. So the tonsils are a big one, and if you have heard me talk before, I talk a lot about the glymphatic system, which I'm going to be talking about today, and then we tie in the tonsils. And so this is an area that a lot of our patients who have chronic neurological and chronic gut issues really struggle with. And this area of tissue is called Waldeyer's ring. We often think of just the tonsils, which many of us know as the palatine tonsils or the adenoids, but we actually have a ring of lymphatic tissue that sits kind of at the base of our throat, which is, an important highway that communicates to our brain and also to our gut, and I'll explain that more. So we have Waldeyer's ring, which is a area of lymphatic tissue. It's composed of the adenoids, and then there are two tubal tonsils that are actually along the eustachian tube. So the eustachian tube is kind of where our ears communicate to our throat, and there's a ring of lymphatic tissue there. And then we have the two palatine tonsils, and then we also have the lingual tonsils that are under the tongue. And then also in this ring is called the laryngeal tonsils, which are actually near the vocal cords. So the big job of this really important lymphatic tissue is it protects us from our environment, from pathogens, as well as toxins as we, inhale and breathe in our environment. So Dr. Klinghardt often calls the tonsils the toilet of the brain. So I think this is a really good way to visualize the tonsils, in that it's this important lymphatic area that is at the base of the brain. And then when this area becomes congested, we can see neurological issues. Also, we can see, more gut issues. And so I write here, all the lymphatics that drain the brain, the sinuses, teeth, eyes, ears, scalp, skull, and bones, and all other tissues above the neck pass through this Waldeyer's ring. This also suggests that infectious agents and toxins originating in the teeth may also affect the tonsils. And then we find that the tonsils are not only functioning lymph nodes, but they're also excretory organs, which I think is interesting. So this is a way that our body excretes potential toxicity, and many of us have seen tonsil stones, and that is suggested an excretory function that the body is trying to eliminate something. And Dr. Klinghardt wrote an article, The Tonsils and Their Role in Health and Chronic Illness, that you can Google. So the tonsils not only sit at the base of the brain, which infects the lymphatic system of the brain, but also at the top of the gut. And we have what we call the gut-associated lymphatic tissue. And that includes not only the tonsils and adenoids, but also Peyer's patches and the appendix. So this is this huge communication network of our immune system. So the immune system of the tonsils and the gut are connected by the system of lymphoid tissue. And the tonsils are really also, when you think about them and their role in our gut health, they're the first lymphatic tissue that our immune system encounters when we're eating food. And it really primes the immune system whether this food is going to be stressful or not. So there's a lot of what we call priming that happens in the tonsils. And so if the tonsils are sick or infected, it can translate into poor gut health. You may have heard me talk about the glymphatic system, and this is a really important system that I think that is, it's newly discovered, and I think the more that we look at this and study this, we'll see that this is a really common denominator in neurological disease if the system is impaired. And so just as a quick snapshot, the glymphatic system is a waste clearance system that our brain uses to detoxify at that time. So it's most active at night. Our brain shrinks about 60% in size to make room for the flow of lymph. And this is kind of how it works. And so the red tubes are arteries. And so the lymph flows along the arteries, and then it moves across the neurons, and it's regulated, the actually flow of fluid is regulated by these cells called astrocytes. They're the yellow cells that regulate the flow of lymph, and then you can see the neurons are in gray. So the lymph is bringing nutrients into the cells and removing waste out of the cells. And you can see these rods on the top image that are looking like waste removal. And then you can see the exit route of this waste is along the veins, which we'll get into later on. And so when someone has had an injury in their brain, this can actually impair the actual functioning of the glymphatic system. And so when there's injury, you can see in the bottom picture, to these neurons and to these cells, and the astrocyte becomes more reactive. What happens is there's going to be less waste clearance, and there's going to be more buildup of essentially metabolic waste and other toxins, and that's going to create damage in our neurons and create neurological illness. So if you'd like to look at abstracts and articles, this is a great one that talks about the glymphatic system. And then this also talks about how our brain shrinks at night to make room for the flow of lymph. And then this is another one that, unfortunately, traumatic brain injuries damage the glymphatic system, and that's probably one of the mechanisms why we see more people like in the NFL or have had repetitive head injuries are more prone to Alzheimer's and dementia. So how do the tonsils and the glymphatic system really interrelate? So remember, the Waldeyer's ring, there's 5 different tissues there. And the palatine tonsils are our tonsils that we think about if you've gotten a tonsillectomy. And that tissue is actually very close to a nerve center called the superior cervical ganglion. And the superior cervical ganglion, again, if you're not a doctor and you don't know this terminology, this is easily Googleable, but it's also something just to give you an overview. But a ganglion, again, is an area of a cluster of nerve cells that has a huge job in communicating to our nervous system. So the superior cervical ganglion has motor fibers. And what these fibers tell the brain, it basically controls blood flow. So the nervous system controls blood flow to the head, the scalp, and the brain. And then also innervates the pineal gland. So what I'm getting to is, if somebody has a chronically, let me take a step back. If somebody has chronically infected tonsils, a history of chronic strep, this tissue is very infected and chronically ill, that can actually affect the nervous system's communications to the arteries, and we're not getting as much blood flow to the pineal gland. This can also happen if you've had a tonsillectomy and you have a lot of scar tissue in that area that hasn't been treated, which we can get into as well. And what happens is if either one of those things are true for you, we have decreased blood flow to the brain, especially the pineal gland. And again, if you don't know, the pineal gland secretes melatonin. And melatonin is very, very important for our sleep. And again, our glymphatic system does not work or really is not effective unless we are sleeping. So if you have poor sleep, poor melatonin production, you're going to most likely have an impaired glymphatic system. So that's the connection I'm making there. And so many people who have a chronic tonsil interference field may have a symptom of chronic insomnia. You may have heard of something called PANS. I'm just bringing this into the clinical realm a little bit, but PANS is an acronym for Pediatric Acute Onset Neuropsychiatric Syndrome, and it was originally called PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder associated with strep infections. This is a pretty devastating illness where young children after a strep infection or a number of infections present with a lot of brain inflammation and a lot of neuropsychiatric symptoms. So, we know it's not just strep anymore. We also know that Lyme can be included, mycoplasma, herpes, influenza, and other viruses. And so what I'm just trying to illustrate here is we know that there are conditions when there is an infection in this area, how it can affect the brain. And I actually went to a talk a couple weeks ago with Dr. Boshtani, who is the medical director of Cyrex Labs, and he was talking about how the tissue in the tonsils and the sinuses, when it's been infected or fighting a chronic infection, it often becomes upregulated with a lymphocyte cell called a Th17 cell. And with the proximity of this tissue to the brain, the Th17 cells can actually access the brain, and then they can destroy the blood-brain barrier. Th17 cells serve a purpose, but they can be very inflammation-producing. So this is just to illustrate that point. So how do interference fields develop? Chronic tonsillitis, also undiagnosed food allergies. So again, with the food priming, so if someone has a dairy allergy, this tissue can become chronically inflamed. We're to talk today also about dental infections. And so when we think if there's any infection or toxin in the mouth, that is going to drain into this lymphatic tissue. So mercury amalgams. Also, if there's ineffective tonsillectomy, so if there's still these tonsillar tags that are remaining, so this tissue that never really quite got cleared, so there's still infection in their area, and then tonsillectomy scars. And so some strategies that we think about, Sophia, to help if this is something that is true for you. Again, I'm not your doctor. This is information just for purely education. And I'm hoping that you can take this information to your doctor to get help if you're seeing this, could be true for you. So we have a video, or two videos actually, on our Sophia site that talk about cranial compressions and lymphatic drainage. So these are self-home tools that you can have either your partner or your loved one help you with the cranial compressions. We have people do these at night. There's self-lymphatic drainage massage as well that Dr. Klinghardt shows a video of, really kind of helping to give yourself a lymphatic drainage massage in the front of your neck. Lymphatic drainage in general. We use a lot of liposomal melatonin, and liposomal products can be very helpful for accessing the brain and tend to be more effective. Ultrasound. So at Sophia, we use an ultrasound technique to help to increase and enhance the flow of the lymphatic system and the lymph in the brain. Essential oils. My friend Jody has the Vibrant Blue oil line that we use. Neural therapy. So ask your doctor if they do neural therapy. This is an alternative medicine technique, but it can really help to enhance lymphatic drainage and help to treat scars and areas of dysfunction. We also recommend sometimes regenerative cryotherapy, tonsillectomies, low-dose immunotherapy, so trying to re-educate the immune system in that area. We also use probiotics, and then this newly developed cream that we created called the Sophia Flow Cream that can really help enhance lymphatic drainage wherever you apply it. So the Sophia Flow Cream, just to spend a moment on this, it actually has a proprietary blend of probiotics that have a number of effects, but the ingredients include chondroitin sulfate, oleic acid, and then phosphatidylcholine from sunflower, which is a liposome. And what we've seen clinically, is wherever we have people apply it, it can help with scar tissue, lymph drainage, blood flow, pain. Again, these are just case reports, but it seems to be a promising tool. And then the self-lymphatic drainage video, this is Dr. Klinghardt on our website. If you want just a tool there, you can use essential oils or creams to enhance the lymphatic drainage, but you can do that without it as well. So another, most common overlooked area when patients come to see us at Sophia is looking at the teeth and looking at dental toxicity and dental infections. And so why the teeth are important is the teeth actually develop from the same embryological tissue as our nervous system. So there's this whole connection between our teeth and our brain in many different ways. And then there's also this acupuncture relationship. If you're familiar with acupuncture, each tooth sits on an acupuncture meridian, and we see these areas of connection between the teeth and the rest of the body. So let's say somebody has a root canal on tooth 8. They might be prone to more kidney, bladder infections. Not to say that that's necessarily the cause, but without resolving the dental infection, that area may never improve. And we see that a lot. And then there's so much information about this now. I'm so happy the word is out. We try to advocate for an amalgam-free mouth. Amalgams are a mixture of mercury, silver, tin, and copper. And mercury is not inert in these fillings. they actually release 2 to 3 micrograms of mercury over an average amalgam lifetime of about 20 years. So this is a huge bioaccumulation in the body. And metals bind to what we call sulfur, which is makes up a lot of our proteins, enzymes, cofactors, cell membranes, and they can impair essentially our body's ability to detoxify. And then metals also can trigger allergy. I talked a lot at the Heavy Metal Summit about the connection between metals and metal allergy and what that produces in the body. So this is something to also kind of just note. There's a phenomenon called electrogalvanism, and when mercury and gold are in proximity in the mouth, it creates a battery effect, and it can also increase the release of mercury from that filling. And so that is going to be increasing the release into the cranial nerves and into the lymphatic tissue and disrupting, again, enzymes, cofactors, cell membranes. And, a lot of, we see this in our patients. People have these, this dental issue can have loss of concentration, memory, insomnia, and then a lot of heart symptoms and different types of pain. So again, I'm just trying to share what we see clinically. And if this is true for you, I would absolutely see a biological dentist and also either a naturopathic doctor or a functional medicine doctor who knows how to comprehensively support you if you decide to do anything about this. So root canals. Root canals are actually dead teeth. They are known to harbor pathogenic bacteria. They also produce what we call highly toxic compounds such as thioethers and mercaptans that can be neurotoxic and carcinogenic. And this is just a note, look for ipsilateral symptoms. So sometimes if someone has a chronic shoulder issue or chronic issue on one side of their body, we also track that into the mouth, breast issue, shoulder issue, some type of pain on that side, we look at the mouth on that side. So that's just a, note there. And then the root canal teeth will show up on x-ray like this with the white root filling. So the roots are taken out and then typically non-biocompatible materials placed inside the root canal. It's sealed and it's unfortunately not a sterile environment. It does grow bacteria over time. And so this is just kind of a, comparison between a healthy living tooth and a dead and root treated tooth. There are doctors or dentists rather, who do treat root canal extractions when appropriate, and it's amazing to see what comes up and how people's health improves with that. You always want to work with a biological dentist. Ozone is something that we absolutely recommend if this is something that you go through with. And then we also try to help heal the bone with different different stem cell effects from using your own blood. And then we're advocating for zirconium implants, which are ceramic implants that are metal-free and typically well-tolerated, especially with people who have autoimmune disorders, neurological issues, chronic health issues, and so forth. And then this is just a lab that we use called DNA Connections, and they'll, take a root canal that's extracted and look at the bacteria that is coming from the tooth. And so this is not a sterile tooth. There's highly pathogenic bacteria demonstrated here. So that's just an example. And then zirconium implants are just, again, they're metal-free. They're more they're better tolerated for the immune system, and they tend to be less disruptive to the gums rather than titanium implants. So again, some things to kind of think about in either your health history or your patient's health history when doing a thorough dental history. And then cavitations are also an area that we look at, and there is, this is what a cavitation, a cross-section of this dead bone looks like. So unfortunately, when often a wisdom tooth is taken out and not properly addressed. And if someone's already immune compromised, there can be these infections that are created in the bone. And what this is an area of dead necrotic bone that lacks blood flow, and it can be a home base, or it can harbor a number of anaerobic bacteria, viruses, parasites. We also have tested this tissue, and it's amazing what comes back. And then what we also see, if someone has a chronically infected wisdom tooth area, again, the proximity to the vagus nerve, that can affect heart symptoms, digestive symptoms. Also, this is on the acupuncture meridian system, connected with small intestine, endocrine, and circulation meridians. So this is something that never do on your own. You really want to work with a knowledgeable team if this is something that you are going to move forward with in your health. And then this is something, that I just want to share with people. It's an insight that we call TVAM. Originally, it was called a chronic spinal cerebral venous insufficiencies, or CCSVI. And this is a patient, it was first noted from Dr. Zamboni years ago. He's a radiologist. His wife had MS. He looked at the veins in her neck rather than the arteries, and found that there was stenosis and malformation in the blood flow leaving the brain. So there's been a lot of controversy around this, but I think it's an important to understand what's going on. And remember when I showed you the picture of the glymphatic system, the lymph flows along the veins. So if there is downstream, it's like a hydraulic system, right? So if there's downstream narrowing or stenosis in the neck, that's going to create pressure and not proper drainage, of blood out of the brain, which translates into congested lymph also in the brain. And so what they did find is when they tracked the veins and then kind of follow them through the brain, white matter lesions typically are around what we call venules, so kind of areas of exit, from the brain. And so that's an area that we know when there is compromised blood flow here, that's going to create a lot of neurodegeneration for a number of reasons. And so there is a technique called transvascular autonomic modulation, where they can go in and open up and stretch those veins. But if you're not addressing the root causes of why they're like that in the first place, the results can be temporary. When they were doing CCSVI, there were some adverse outcomes, especially with stents, which are essentially tubes left in the veins to keep them open. And that created, obviously, controversy and poor outcomes that none of us would ever want for a patient. But if you're thinking about, okay, why are these veins stenotic in the first place? It can be, we have a number of theories. We can think from the chronic stress of the infections and the toxicity in the dental department. We also think about infections lining the blood vessels or the endothelium, and that creates basically the infections try to create a more opportunistic environment to receive nutrients in that area, so there can be more. They use it as kind of a way to get more nutrient-rich blood to the area and thrive. And so our thought is clean up the mouth, clean up the bugs, and then there's a lot of also non-invasive techniques to open up the blood flow in the area. So the main point I'm trying to get across with all of this is the neck is a really important highway in and out of the brain. And it really, has a lot going on. We have veins, we have arteries, we have lymph, we have nerves. And the better we are in this area, the healthier we are. So just some ideas that we use the Sophia Flow Cream that I talked about. We also use other vascular healing agents, like Deep Purple. That's just a lot of antioxidants. So if filling your system with antioxidants, this has acai, pomegranate, and plum. We also treat the infections. We do a lot of Lyme treatment. The BioPure cocktail is a liposomal formula that is very effective for Lyme and co-infections. manual lymphatic drainage massage, ultrasound, addressing the bite, so how our teeth basically touch with opening and closing. That has a huge effect on drainage in the brain. Neural therapy, if your doctor does that, and then improve, of course, the health of the sinuses, the tonsils, the teeth, before ever doing anything invasive in the neck. So I touched on a lot of big points that we see are often overlooked when patients come to see us. So when we're covering the brain, think about, do you still have your tonsils? Do you have a history of strep or tonsillitis? If you've had a tonsillectomy, how's the scar tissue in that area? Have you had a head injury? This can be very detrimental to the glymphatic system, and there's lots of ways to recover your brain post-head injury, but of course, making sure you address this. How is your sleep? If you're having poor sleep, we have to address that because that's going to be really important to recovering the brain and improving the lymphatic system. And then what about your mouth? Have you had amalgams? If you've had them, it's one thing to have them out, but you also have to have a really an appropriate detoxification protocol to deal with, the bioaccumulation of mercury in the nerves. Do you have root canals? Do you still have your wisdom teeth? Are they impacted? When you got them out, did you have dry sockets? Do you have a lot of stomach issues or heart issues that in spite of a lot of treatment are still unresolved? Maybe think about the mouth. And then, again, TVAM is a highly specialized treatment that only a few doctors do in the country. And again, should be only done in a really supportive team environment. So I hope this information is helpful and not overwhelming. What I wanted to share again is just some ideas around what we see at Sophia Health Institute. And then we're going to be sharing more and more information that, over the next few months that you guys have requested. And we so appreciate all the responses. And if you're able to, please visit us at Sophia. And also I just wrote a link to sophiahi.com where we have lots of blog articles, lots of ways that we want to keep you informed of what we're doing. And then our website is also Sophia Nutrition if you are interested in any of the supplements. So I hope this was helpful. Again, we really appreciate all your feedback and your time, and I look forward to getting to know all of you more.